Have you ever made a decision in the heat of the moment, one that you later regretted? Now, imagine living that state constantly, where intense emotions drive impulsive actions. This is the reality for many individuals with borderline personality disorder. Hello, I'm Dr. Katia Batista, a psychiatrist committed to providing scientifically grounded and accessible mental health information. Welcome to the third episode of our mini series on borderline personality disorder. In previous episodes, we have explored chapter 1, its definition, the diagnostic criteria, and debunking some myths. Chapter 2, how emotional dysregulation, one of the core symptoms in borderline personality disorder, impacts relationships, work, and everyday interactions with real life examples. If you haven't seen them yet, I encourage you to watch those episodes for a comprehensive understanding. Today, we will delve into everyday examples of impulsivity, the nature and emotional significance of self harming behaviors, clinical approaches to addressing these behaviors, the neurobiology underlying impulsivity, and effective therapeutics interventions. Impulsivity in borderline personality disorder often manifests in everyday situations. Financial decisions, sudden, unplanned spending sprees leading to financial strain, relationships, like I have said in the previous episodes, engaging in intense relationships quickly, sometimes with unsuitable partners, eating habits, episodes of binge eating or restrictive dieting, substance use, turning to alcohol or drugs to cope with emotional distress. These actions are typically immediate responses to overwhelming emotions, providing short term relief but often resulted in long term consequences. While impulsive actions like reckless spending or sudden relationships decisions are outward expression of emotional dysregulation, there is another, more inward and concerning manifestation that we must address: self harming behaviors. These are not simply impulsive acts, they often reflect deep emotional pain in a hallmark symptom of borderline personality disorder. Let's take a deeper look at what self harm means in the context of this condition, why it happens, what it communicates emotionally, and how it can be approached clinically and compassionately. Self harm or non suicidal self injury is a prevalent behavior among individuals with borderline personality disorder. Intentional self inflicted harm without suicidal intent. The purpose is a coping mechanism to alleviate intense emotional pain, feelings of emptiness, or dissociation. The emotional significance provides a sense of control or a way to express internal confusion. It's crucial to approach this behavior with empathy and understanding, recognizing it as a symptom of deeper emotional distress. Addressing self-harming behaviors involve validation, acknowledging the individual's pain in the function of their behavior, safety planning, developing strategies to manage urge and ensure safety is essential. Skill development, teaching alternative coping mechanisms such as distress tolerance and emotional regulation skills. A non-judgmental and supportive therapeutic environment is essential for effective intervention. Research indicates that impulsivity in borderline personality disorder is linked to prefrontal cortex, responsible for decision making and impulse control, often underactivated in borderline personality disorder. Amygdala, like I highlighted in previous episode, processes emotions, tends to hyperactive, leading to heightened emotional response. The neurotransmitters imbalance, the dysregulation serotonin and dopamine may contribute to impulsive behaviors. Understanding these biological factors underscore the importance of comprehensive treatment approaches. Several evidence-based treatments have shown efficacy in managing impulsivity and self-harming behaviors in borderline personality disorder. I think I mentioned briefly then in previous episode. Dialectic behavior therapy combines cognitive behavioral techniques with mindfulness practices to enhance emotional regulation and distress tolerance. Mindfulness-based therapies focus on increasing present moment awareness and reducing reactive behaviors. And the last one, pharmacotherapy. While medications they are not really approved specifically for this, they can address depression, anxiety, impulsivity in this kind of condition. A tailored treatment plan, often combining psychotherapy and medication, offer the best outcomes. Impulsivity and self-harming behaviors are challenging aspects of borderline personality disorder, but with appropriate treatment and support, individuals can learn to manage these symptoms effectively. If you found this video helpful, please like, share, and subscribe to my channel for more content on mental health. Thank you for watching, and remember, seeking help is a sign of strength. Subscribe, stay updated with our latest videos on mental health topics. Share, help spread awareness by sharing this video with others. Comment, share your thoughts or questions below. Your engagement helps us create more relevant content. Thank you.